Percentage probability of having the disease. Patient A, 90% chance of having the disease before the test is done. 34.6% chance of having the disease if the test is negative. 98.3% chance of having the disease if the test is positive. Patient B, 50% chance of having the disease before the test is done. 5.6% chance of having the disease if the test is negative. 86.4% chance of having the disease if the test is positive. Figure 1.5. The interpretation of a test result depends on the probability of the disease before the test is carried out. In the example shown, the test being carried out has a sensitivity of 95% and a specificity of 85%. Patient A has very characteristic clinical findings which make the pretest probability of the condition for which the test is being used very high, estimated as 90%. Patient B has more equivocal findings such as the pretest probability is estimated as only 50%. If the result in patient A is negative, there is still a significant chance that he has the condition for which he is being tested in patient B. However, a negative result makes the diagnosis very unlikely. 1.5 Predictive values. What is the probability that a person with a positive test actually has the disease? Positive test. A. True positive. B. False positive. Negative test. C. False negative. D. True negative. Positive predictive value. A divided by A plus B into 100. Negative predictive value. D divided by D plus C into 100. A problem because they have not accurately represented the problem in the first place. The ability to synthesize all the available information and encapsulate it into a problem representation using precise medical language is an important skill that helps to organize and retrieve knowledge from long-term memory relevant to the case and is associated with significantly higher diagnostic accuracy, particularly in complex cases. Formulating a problem representation. Example: a 30-year-old pregnant woman with acute left-sided pleuritic chest pain and breathlessness, or a problem list. Example: persistent vomiting, hypokalemia, acute kidney injury, not only helps to organize and retrieve knowledge relevant to the case, which helps in diagnosis, it also helps to formulate an action plan while further information is being gathered when a diagnosis is not yet possible. Cognitive biases. Advances in cognitive psychology in recent decades have demonstrated that human thinking and decision making are prone to error. Cognitive biases are subconscious errors that lead to inaccurate judgment and illogical interpretation of information. They are prevalent in everyday life, as famous saying goes, to err is human. Take a few moments to look at this simple puzzle. Do not try to solve it mathematically, but listen to your intuition. A bat and ball cost 1.10 pounds. The bat cost 1 pound more than the ball. How much does the ball cost? The answer is at the end of the chapter. Most people get the answer to this puzzle wrong, even though they have all the knowledge and experience they need to solve this problem. Why? British psychologist and patient safety pioneer James Reason said that our propensity for certain types of error is the price we pay for the brain's remarkable ability to think and act intuitively, to shift quickly through the sensory information that constantly bombards us with wasting time trying to work through every situation anew. This property of human thinking is highly relevant to clinical decision making. Type 1 and Type 2 thinking. Decades of studies in cognitive psychology and more recently functional magnetic resonance imaging demonstrate two distinct types of processes when it comes to decision making. Humans have a fast, intuitive pattern recognizing way of thinking, which uses little cognitive effort, known as type 1 thinking, and a more deliberate analytical one, which engages our working memory, known as type 2 thinking. This is known as dual process theory, and box 1.6 explains this in more detail. Psychologists estimate that we spend 95% of our daily lives engaged in type 1 thinking, the intuitive, fast, subconscious mode of decision making. Imagine driving a car, for example. It would be impossible to function efficiently if every decision and movement were as deliberate, conscious, slow, and effortful as in our first driving lesson. With experience, complex procedures become automatic, fast, and effortless. The same applies to medical practice. This is evidence There is evidence that expert decision making is well served by intuitive thinking. The problem is that although intuitive processing is highly efficient in many circumstances, in others it is prone to error. Clinicians use both type 1 and type 2 thinking, and both types are important in clinical decision making. When encountering a problem that is familiar, clinicians employ pattern recognition and reach a working diagnosis of or differential diagnosis quickly, type 1 thinking. When encountering a problem that is more complicated, they use a slower, systematic approach, type 2 thinking. Both types of thinking interplay. They are not mutually exclusive in diagnostic process. Figure 1.6 illustrates the interplay between type 1 and type 2 thinking in clinical practice. Errors can occur in both type 1 and type 2 thinking. For example, people can apply the wrong rules or make errors in their application while using type 2 thinking. However, it has been argued that the common cognitive biases encountered in medicine tend to occur when clinicians are engaged in type 1 thinking. For example, imagine being asked to see a young woman who is drowsy. She is handed over to you as a probable overdose because she has a history of depression, and a packet of painkillers was found beside her at home. Her observations show she has Glasgow Coma Scale score of 10 out of 15, heart rate 100 beats per minute, blood pressure 100 by 60 millimeter mercury, respiratory rate 14 breaths per minute, oxygen saturation 98% on air, and temperature 37.5 degrees Celsius. Already your mind has reached a working diagnosis. If fits a pattern thinking, if it fits a pattern type 1 thinking, you think she has taken an overdose at